Hey everyone, and welcome to The Explainer. Today, we're diving into something that's right at the heart of modern medicine: data privacy. Specifically, we're looking at GDPR in healthcare and how it's all about protecting something that's, well, pretty much everything: trust.
So let's just start with a really big question. What actually happens when a patient's most sensitive information gets compromised, even if it's an accident? The fallout from that goes way beyond just a simple mistake. It can seriously damage the foundation of the whole patient-doctor relationship.
And that really gets to the core of what we're talking about today. This isn't just a catchy phrase, it's the whole idea, right? It connects all the technical rules of data protection to that deeply human element of trust in healthcare.
Yeah, it's so much more than a checkbox. Because, in any clinical setting, data protection is never just about ticking a box for compliance. It's really a direct line to our ethics, to building trust, and honestly, to keeping patients safe.
Okay, so what exactly is this framework that's become the gold standard all over the world? Let's decode the regulation at the center of it all, the GDPR.
So, GDPR stands for the General Data Protection Regulation. It's a landmark EU law, for sure. But here's the real kicker. Its reach is global. So even if your hospital or lab is outside the EU, if you're handling the data of EU citizens, say for clinical trial or even telemedicine, these rules absolutely apply to you.
And this is why it's so important in our field. Under GDPR, your health information isn't just treated like any other data. Nope. It's officially called special category data, which is basically a way of saying it needs the absolute highest level of security and care. It's a recognition of just how incredibly sensitive this stuff is. So how does GDPR actually pull this off? Well, it's all built on 7 core principles. I want you to think of these not as just a list of rules, but more like the foundational pillars holding up this whole structure of ethical, trustworthy data handling. And here they are. You can almost see the story they tell, right? It all starts with being lawful and transparent. Then you limit the purpose and amount of data you collect, make sure it stays accurate, don't keep it forever, and finally, you keep it secure and hold yourself accountable. It's a really cohesive framework. Let's just zoom in on 2 that are super important in our day-to-day.
First up is data minimization. The idea here is so simple, but it's incredibly powerful. Just collect the data you absolutely need and nothing more. For example, if you're doing a routine blood test, do you really need a patient's entire extended family medical history? Probably not. It's all about being focused and respectful.
And that leads right into this next one, purpose limitation. This is huge. It means that if you collect data for a patient's treatment, you can't just turn around and use it for your hospital's next marketing campaign without their explicit, fully informed consent. The purpose you state at the beginning is the only purpose you can use it for. Period.
Okay, so we've got the theory down, but what does all of this actually look like in practice? Let's talk about turning these principles into real action, day in and day out, in a clinical or research setting.
This number, this says it all. 72. That's it. In the event of a serious data breach, you have a maximum of 72 hours to let the authorities know. That's a crazy tight deadline, and it really underscores the urgency, because every single hour that a breach goes unreported, patient trust is on the line.
So what can you do in your daily work? Well, it means things like always using encrypted systems to share information. It means writing consent forms in plain, simple language that people can actually understand. And it means anonymizing data for research. These aren't just best practices anymore. Under GDPR, they're basically your essential duties.
Now, let's be real for a second. Nobody's saying that implementing GDPR is a walk in the park. It can be complex, it requires investment, but here's the thing. For every hurdle, there's an incredible reward on the other side. That hard work of compliance, it leads directly to stronger patient trust. The need for better tech, it actually drives amazing innovation in cybersecurity that makes everyone's data safer.
And for all the researchers out there, GDPR is not a roadblock. It's actually a critical partner. It encourages these really smart techniques, like pseudonymization. That's where you swap out identifiers like a name for an artificial code. It's a game changer because it allows vital international collaborations to happen without ever exposing a patient's actual identity. All right, as we start to wrap this up, there's one really important takeaway that I want to leave you with. It's a simple idea, but it's a profound shift in how we think about this stuff. At the end of the day, it all boils down to this. Protecting a patient's data is just as fundamental to their health and well-being as giving them the right diagnosis. Privacy isn't just some legal hoop to jump through. It is an essential, non-negotiable part of patient care. And so that leaves us with a final thought to take back with you. In a world that runs on data, how are you navigating that delicate balance between using information to heal and upholding the absolute duty to protect it? Thanks for tuning in.